Hello everyone, I'm Dr.K N Prajwal. I'm an orthopedic surgeon with specialization in joint replacement and advanced trauma. I work in Uttarahalli Nano in morning hours. The treatment of arthritis depends on the stage. So initial stages like grade 1 and grade 2 can be managed with physiotherapy medications usually. In some patients, we might require some intraarticular injections to knee like hyaluronic acid. So that hyaluronic acid is a gel type substance which mimics what's there in our knee, and it can prolong the further damage up to 1 year as proven as studies. Then again, in later stages of arthritis, so the best treatment as per today is total knee replacement. Total knee replacement when the patient is unable to walk around for at least small distance and unable to do his day-to-day activities. So joint knee replacement is the best till now.